Have you ever wondered why trust is so essential and yet so fragile? How one act of betrayal can shatter it in a heartbeat? Trust, that invisible thread that binds us together, is the bedrock of human relationships. From the moment we are born, we instinctively rely on others for survival. As we grow, this reliance evolves into trust. A trust that those around us will act in our best interest, that they'll be there when we need them, that they won't intentionally cause us harm. This trust, so fundamental to our existence, becomes a vital part of our identity, our sense of security, and our perception of the world. But what happens when this trust is broken? What happens when the people we lean on, the ones we care for, the ones we trust the most, betray us? This act of betrayal, a violation of trust, can shatter our world in an instant. It's like a mirror that's been broken. Even if you manage to piece it back together, the cracks are always there. A constant reminder of the betrayal. This brings us to a concept that is as intriguing as it is heartrending: betrayal trauma. It's a kind of psychological distress that occurs when someone we trust deeply inflicts harm upon us. It could be a friend revealing a secret, a partner being unfaithful, or a parent neglecting their child. The pain of betrayal trauma is unique. It's not just about the act of betrayal itself, but the loss of trust and the shattering of the secure world we once knew. Betrayal trauma can leave deep emotional scars and can significantly impact our ability to trust again. It can make us question our judgment, our self-worth, and even our understanding of reality. Yet, it is through understanding the intricacies of trust and betrayal that we can begin to heal, to rebuild, and to find a way to trust again. Betrayal trauma is a unique kind of pain, one that arises when the people we trust the most turn against us. So, what exactly ignites this profound emotional agony? Let's delve into the causes of betrayal trauma. Betrayal trauma occurs when someone we deeply trust breaks that trust in a critical way. This breach can be so severe that it disrupts our psychological foundations, shaking the very ground we stand on. The causes of this type of trauma are varied, but they often include some of the most painful experiences a person can endure. First, let's consider infidelity. When a partner is unfaithful, it can feel like a direct attack on the foundation of trust in a relationship. The emotional impact is profound because the betrayed person's sense of reality is shattered. They often question not only their partner's commitment, but also their own judgment and self-worth. Deception, another significant cause, encompasses more than just lies. It can involve the concealment of important information, leading to a situation where the deceived person feels manipulated and deeply hurt. The realization that one's partner, friend, or family member has been deceitfully manipulating situations can lead to long-lasting emotional scars. Abuse, whether emotional, physical, or psychological, is also a potent cause of betrayal trauma. The trust violated here is fundamental because the victim often depends on the abuser for love, security, or support. When that trust is met with harm, the damage to the victim's psyche and emotional well-being is severe. Lastly, abandonment plays a crucial role, particularly when it occurs without warning. The sudden loss of a significant relationship, especially without closure, can lead to feelings of betrayal and unresolved grief. This type of trauma often leaves individuals questioning their value and struggling with feelings of worthlessness. Understanding these causes helps us see why betrayal trauma is so complex and deeply wounding. It's not just about the betrayal itself, but also about the crumbling of trust and security that previously held one's psychological well-being in balance. Now that we understand the causes, it's time to recognize the signs. Spotting the symptoms of betrayal trauma isn't always straightforward. It's a silent scream echoing within. Today, let's delve into the hidden signs of this profound emotional injury. Betrayal trauma can manifest through a mosaic of symptoms spanning emotional, psychological, and physical domains. Emotionally, individuals may experience intense feelings of sadness and anger. Imagine the heartache of losing a loved one. That's the depth of despair betrayal can invoke. These feelings often evolve into depression, a heavy cloak that dims the joy in everyday activities. Anxiety is another common emotional symptom. It's like a constant nagging whisper of worry that shadows one's every step, fueled by the uncertainty betrayal introduces into one's life. This pervasive anxiety can lead to social withdrawal as trust becomes a casualty. The world no longer seems safe, and every relationship is filtered through the lens of suspicion. Psychologically, betrayal trauma can severely impact one's sense of reality. Victims often struggle with intrusive thoughts, unwanted guests that replay the betrayal over and over, hindering healing and peace of mind. This can escalate into a condition known as post-traumatic stress disorder, where one feels perpetually on edge, stuck in a loop of fight, flight, or freeze responses. Physically, the stress of betrayal can be just as debilitating. Insomnia is a frequent complaint, with individuals tossing and turning as restful sleep becomes elusive. There's also a notable increase in physical symptoms like headaches and digestive issues, which are direct manifestations of the stress and anxiety harbored within. Moreover, some might experience a startling loss of memory or concentration, making daily tasks more challenging. It's as though the mind is too preoccupied with processing the betrayal to focus on anything else. Recognizing these symptoms is the first step towards healing. But how do we treat betrayal trauma? Scene script. Navigating the road to recovery from betrayal trauma is a journey, not a destination. And every journey begins with a single step. When betrayal shatters the foundation of trust, the path to healing might seem obscured and daunting. Yet, understanding the treatment options available can illuminate this path, guiding one toward restoration and peace. First and foremost, therapy stands as a cornerstone in treating betrayal trauma. Engaging with a qualified therapist who specializes in trauma can provide a safe space to explore the feelings of hurt and betrayal. Cognitive behavioral therapy, or CBT, is particularly effective. It helps individuals reframe negative thoughts and develop healthier coping mechanisms. This kind of therapy focuses on altering the thought patterns that contribute to a person's emotional distress, replacing them with more balanced and less distressing thoughts. Another therapeutic approach is eye movement desensitization and reprocessing, or EMDR. This technique is designed to alleviate the stress associated with traumatic memories. Through guided eye movements, EMDR helps the brain reprocess these memories, reducing their emotional impact over time. In addition to individual therapy, group counseling or support groups offer significant benefits. These groups provide a platform where individuals can share their experiences and feelings in a non-judgmental environment. Realizing that others have faced similar challenges and survived can foster a sense of community and support, crucial elements in the healing process. Support groups specifically for betrayal trauma can vary in focus. Some might concentrate on emotional healing, while others might address practical issues like rebuilding trust in relationships. The shared experiences within these groups can profoundly validate and empower individuals, helping them feel less isolated in their pain. Self-care is another vital component of the treatment process. It involves activities and practices that nurture physical, mental, and emotional well-being. This can be as simple as maintaining a balanced diet, regular exercise, and sufficient sleep, which are all essential for psychological resilience. Engaging in hobbies, practicing mindfulness or meditation, and setting aside time for relaxation can also play a transformative role in managing stress and enhancing overall well-being. Let's not overlook the importance of social support from friends and family. Having a supportive network can provide emotional comfort and practical help during tough times. Sometimes, just knowing that there are people who care can make a significant difference. It is also crucial to highlight that while these treatment options can be highly effective, the pace and nature of recovery can vary widely among individuals. Healing from betrayal trauma is a deeply personal process that unfolds differently for everyone. Patience and persistence are key. For those walking this path, remember that professional help is not just a resource, it is a beacon that can guide you through the darkest times towards a future where trust and joy can be rebuilt. Remember, it's okay to ask for help. You are not alone in this journey. Betrayal trauma can be a difficult concept to grasp. It's a silent battle, but one that can be won with understanding and support. As we've explored today, the causes of betrayal trauma stem from deep-seated breaches of trust, often by those closest to us. This can range from infidelity to deceit in personal or professional relationships. Recognizing the symptoms is crucial. They can be emotional, such as feelings of confusion and anger, or physical, like insomnia and anxiety. Understanding these symptoms is the first step towards healing. Treatment is equally vital. It involves therapeutic strategies like cognitive behavioral therapy and support groups, which offer a space for shared experiences and recovery. Healing from betrayal trauma isn't a linear journey, but with the right tools and support, progress is more than just possible, it's probable. If you found this video informative or helpful, please consider subscribing, liking, and sharing with others. Together, we can shed light on betrayal trauma and help those who are silently suffering.